Hello, I'm Dr. Russell Libby, and I welcome you to the world of medicine. For many people, having a family, raising kids, is one of the most important and fulfilling parts of their lives. And for most people, having a family is not really that difficult. It comes pretty easily. In fact, it's a lot of fun. But there are a significant number of couples, maybe 1 in 7, who have a difficult time conceiving. Now, sometimes that may be something that just is a temporary problem. Sometimes it's something that is more significant and requires investigation by special doctors called fertility specialists and interventions and treatments to help them conceive and have babies. There's a whole world of information out there and a lot of different types of experiences and causes and reactions that people have when they have to go through these kinds of ordeals. We have a great audience here. They're going to share their experiences with you. They're going to help you understand what it is that really happens when you want to have babies, and it's a little more difficult than you might expect. We have some great expertise. We have Dr. John David Gordon and Dr. Michael DiMattina. They are reproductive endocrinologists. They are Dominion Fertility in Arlington, Virginia. Reproductive endocrinologists are obstetricians who go through the normal training to become obstetricians and gynecologists. That's 5 years of residency after medical school, and then put in 2 more years so that they can learn about the techniques to evaluate and to treat women who are having difficulty with conception. So I guess if you're here, there's some reason. Mm-hmm. Have you always wanted to have babies?
Yes.
And do you have babies now?
Yes, we have a 3-year-old and a 1.5-year-old.
Did you always want to have babies?
Yeah, family was always a big part of both Carrie and myself growing up. So it seemed like the natural progression is that we would want to raise children of our own. Plus, being teachers, we were raising everybody else's kids, or helping to raise everybody else's kids. So we thought it was always, we'd want to have babies of our own.
Did you have a big family growing up?
We're both 1 or 2, but family was always around, and I think we both had pretty good role models, and both of our parents who've been together forever, right. And so we knew that was just part of the family process.
So being a kid yourself was a positive experience. It gave you inspiration.
Mm-hmm.
You wanted to have some of your own. Great.
Yeah.
And did you always want to have babies?
Absolutely.
Absolutely.
Yeah.
And you came upon having babies at what point in your life?
Actually quite late. I spent quite a few years in graduate work and postdoctoral work, and I met my husband later in life, and so had to make the decision as to whether we were going to be able to move forward because of my advanced maternal age.
Right.
So.
Well, I guess you're talking about that biological alarm clock that's...
Yeah, the gong.
The gong
Right. That was going off.
Turn off the music and there's the gong. Did you always want to have babies?
Oh, absolutely. Yeah. And I have older children as well, and but as my wife mentioned, we wanted children with our marriage, and so this was a very important part of our lives.
And we can see that we have one here who's fading fast, but well, I won't ask you any questions right now. Later on, after your little nap, okay? Babies, always wanted them?
Absolutely.
Did you come from a big family?
I did. I'm one of 6 kids.
One of 6 kids. You must have had some pretty big expectations placed upon you.
Absolutely. I never thought that people didn't have lots of babies. I didn't realize that infertility even existed.
So, yeah, I would imagine if you have 6, and where were you in those 6?
I was the second.
You were the second. So for you, it was one after another. It's an easy thing. Did you come from a large family?
No, I didn't. I was just one of 2, but
one of 2.
Shared Heather's desire to have a large family. Actually, I felt kind of like I was always at a disadvantage in a small family, and it was always a goal of ours to have a large family. So, yeah.
Wonderful. Did you always want kids?
Actually, no, but later on in life, once that clock started ticking, I did. It changed my mind. And
So you were looking around and you thought, it is something I want to try.
It was indeed. It was time, and I had a very happy marriage, and we felt that it was that time that we were ready to welcome a family.
And families aren't always that easy.
No, unfortunately not. We thought that we'd get pregnant right away, and then we were very surprised the first month when it didn't work.
Isn't that amazing? After all those years of being careful.
That's right.
And then
we
all of a
thought,
sudden,
oh,
gee, we didn't have to be careful. That careful anyway.
That's
My.
right.
All right, well, that's, we'll have to hear more about how that happened. So we heard from one of our guests here that she heard that alarm clock. I don't think you heard an alarm clock. It doesn't sound like yours would even be going off yet.
Well, our first two children actually were conceived very easily.
Yeah.
So they were 21 months apart, and we were pregnant with our third pregnancy, and I had an ectopic pregnancy, which, again, I'd never even heard of an ectopic pregnancy. And by the time we got medical treatment, I actually lost a fallopian tube. So it was kind of this downward spiral that we tried to conceive and didn't have luck. And then we started fertility treatment with a different doctor and didn't have luck, and started getting all sorts of diagnoses that I had old eggs and all sorts of stuff that you don't want to hear when I was, I think, 32 at the time. So, but now we have a baby, and we are very thankful for the world of infertility.
So now you have 3 babies.
Yes, we do.
You have 3, so that's great. Dr. DiMattina, tell me, infertility, how do you define it? I mean, we're hearing that people try 1 month. Well, is that infertility, or is that just bad luck?
That's bad luck.
Right. Okay.
You know, it's interesting, knowing what I know as a fertility specialist, a little tongue-in-cheek, I'm amazed that the human race has continued on, you know, because there's so many ways that a person can become infertile. And nobody asked for this, you know, nobody wanted it. But it's quite common. I would say it's not uncommon, but it's a medical disease, just like hypertension, diabetes, heart disease. And you know, I think today most people, through shows like yours and other media that's available, they are now more cognizant and are taking charge of their infertility. But to answer your question, the medical definition would be 1 year of trying to get pregnant, but with no success. However, the textbook has been modified. And now they say, and I agree with this, that if you're 35 years of age or older, that you shouldn't wait. You know, if you've been trying for, 3 to 6 months and nothing's happening, don't wait, because age is such an important factor in this process, this infertility process. And I think you're going to hear some of that maybe perhaps tonight. We already heard a little bit about that.
So he's saying 35. You were 42, is that what you said?
Well, I was 42 when they
when you
retrieved
conceived.
my eggs the day before my 42nd birthday.
Wow.
But we had started seeing or going to Dominion when I think I was 38. So we gradually worked into the whole process of fertility treatments. We started a little less aggressively because apparently my anatomy looked very healthy, and we thought we could probably conceive on our own still. But as time went forward and we moved through the tests, we worked at being more and more aggressive.
Right. So we've heard of age being a factor, which sounds like it was. What does age do to a woman's fertility?
The age process, God unfortunately did not create us equal in this respect, is that it affects the female more than it does the male, unfortunately. And she is born with all of her eggs when she comes into this world, and then she starts to lose eggs, and they start to age, just as we age. The man, on the other hand, makes new sperm every 2.5 months. And this is how you see these guys in Hollywood and so forth. You know, they find a young gal, he's 80 years old, she gets pregnant, they have the baby, and he dies, and she gets the money, and she's got the baby, and she doesn't have, I'm only kidding, but the fact of the matter is, it affects the egg quality as one gets older. And so it becomes harder to become pregnant. And that starts, actually, that aging process becomes significant starting at about age 30, and much, much more so at 35, markedly so at age 40.
So that aging process affects the quality of the eggs, and I guess there are other elements that can further affect them from a genetic point of view as well. So what are the kinds of things that are out there that people may not be aware of, but as they aged, those eggs being there from literally from birth, what happens? What are the kinds of things people need to be aware of?
Well, that is the big issue, Russell. I mean, what happens then is these eggs have been sitting there in suspended animation since birth, and what happens then is just before fertilization, the egg has to split off half the chromosomes. And if the chromosomes are sticky because of this long delay in this suspended animation, you can then end up with an extra chromosome being dragged along. So as the sperm fertilizes that egg, you have an extra chromosome that was left behind, so now you end up with one extra copy that you don't need. If you have an extra copy of chromosome 21, then this is Down syndrome. Down syndrome is known because those children survive and can live productive lives, but there are many of these diseases or many of these conditions where you have an extra chromosome 13 or 15 or 18, which is not compatible with life. In these cases, miscarriage, will usually occur oftentimes in the first trimester. So that ends up being the biggest issue. The other factors that can happen, as Mike pointed out, is just with the aging process, the number of eggs simply also decreases. So what happens when we go to help these couples with fertility drugs, we can only rescue as many eggs are available for that month. And if you're in your 40s, as opposed to when you're in your 20s, when there might be 20 to 25 eggs that you could use, by the time you're in your early 40s, you might be down to just a handful each cycle. Maybe one of those is a good egg, maybe it's not. The only way we know it's a good egg is when you bring the baby in and say, well, here's my baby. And you say, yep, Rebecca, that's a good egg. And you have two good eggs, because there they are. So that's the ultimate test. And unfortunately, there is no other way. So we are always assuming that there's a good egg in there when we're launching into fertility treatment.
Are there environmental factors that affect the eggs themselves beyond just the age?
Well, I think, obviously, one of the things we're dealing with now is, patients who are diagnosed with cancer who are exposed to chemotherapy, and that can obviously harm the eggs as well. In the environment, we're always exposed to ionizing radiation, to toxins, and, this may hasten things as well. We're concerned about the fall in sperm counts worldwide. This may also be resulting of us being exposed to, certain things in the environment. But age really, as Mike pointed out, really trumps all. I mean, that's a big factor. There are other issues for our couples, too. I mean, as Heather alluded, she had lost a fallopian tube to this ectopic pregnancy that just came out of the blue. So then she was working on only one tube, so that means half the months an egg was being released in a side where there is no tube. So her fertility was, immediately cut in half in terms of reaching that goal. And the tube left behind is at higher risk for an ectopic pregnancy as well. So again, we see all these different factors. There's a disease called endometriosis, which sometimes is very silent, and this is a progressive disease which can cause harm to the ovary, and the eggs are actually, destroyed along the way, and it can also cause the fallopian tubes to not function well, and may also affect fertilization itself. And endometriosis can be silent, but yet when we see our patients on a first visit and we do an ultrasound, sometimes we can tell by the ultrasound that, aha, this person probably has endometriosis.
Right. And I guess it's worth, as we're starting to talk about that anatomy, how does it happen? I mean, the egg is released, it goes into the fallopian tube. That's connected to the ovary? That's sort of like the funnel into which the egg goes? And then fertilization takes place?
Yes. The egg is released, and a lot of people have this misperception that the fallopian tubes are like a pipe. It's just a solid pipe that sits there in the pelvis. But actually, it's not true at all. The tube moves around in the pelvis looking for an egg all the time. And sometimes we see people who have completely normal appearing fallopian tubes, but they're not normal. They look normal, but they're not behaving normally. They can't find the egg. And that is one of the causes for unexplained infertility. Everything looks good. The tubes are open, she ovulates normally, sperm looks good, but there's no baby. And so in couples like that, the tube doesn't function properly.
So one of the areas, obviously, you have the ovary. What percentage of pregnancies are inhibited by defective ovulation?
About 15–20% women have problems with their ovulation. And that's easy to diagnose.
Right.
All I have to do is ask the patient, how often do you have a menstrual cycle? And if she says, oh, every 26 to 30 days, that's very regular and that's a good ovulation. But if she says it's irregular or absent, then her ovulation is irregular or absent, and she may have some problems.
So there's some reasons for that. Yeah. So, systematically, what kinds of things? Was ovulation an issue for you?
Yes.
And did you have any clue in the first place?
No. I mean, well, I never got my period, so I guess that would be a
Ever?
clue. No. Well, no. I did for a little while, and then it just kind of went away.
You don't look
and
like
it never
you
came
missed
back.
it forever. But, so you had basically regularly irregular.
Regularly absent.
Yeah. And you thought, what? Did you think that there was something wrong? I mean, did you check that out early on and discover that there was an issue with ovulation? Or did somebody put you on birth control pills and tell you, we'll get it regulated, don't worry, we'll make it happen?
Well, really what happened was I went off birth control pills and I never got my period. And I just, for a while, I was fine with that because it's mostly just a pain anyway.
Right.
But when we got married, I was like, all right, let's have kids right now. And he got me to wait a little while, but then nothing was happening. And I did go see an OB or a gynecologist who put me on some medication that did nothing. And that was when a family friend of ours referred us to Dominion Fertility. And we kind of went from there.
Good. So as you started with, you have the ovarian failure or the ovulation failure, and that can come from the brain, it can come from a local factor, it can come from any number of different, let's say, origins.
Yes. And Carrie, to find out if she had ovulatory dysfunction, I just asked her, how often do you have your periods?
Right.
And she said, what periods?
Right. Okay.
And so we knew right away that there was an ovulatory problem. And that's what we addressed.
Would you have asked your original gynecologist about that?
Yeah, but I think Dr. DiMattina told me once that I was just out of their league.
Out of there.
Did I say that?
Maybe not in those words, but
Thank you.
It's out of character.
they're just not used to dealing with someone who's maybe abnormal, which is how I would define myself.
Oh, yeah. Okay. Well, I think you're probably one of the only people who would define yourself that way. But that's a good thing. So you have that element. We have an ectopic pregnancy, which, as you described, can happen. There are things that you'd have no prediction, you have no way of really knowing that's going to happen. What are some of the reasons you might consider an ectopic occurring or a fallopian tube becoming dysfunctional so that it doesn't work in the process?
I mean, one of the problems we see in terms of tubal disease is unfortunately being exposed to sexually transmitted infections, such as gonorrhea and chlamydia. Chlamydia in particular, because it can be relatively silent. So although it's a bacterial infection, it may not demonstrate, may not present with a fever or pain, and may be picked up just on a pelvic examination at the time of a pap smear is being performed. But if you are infected with chlamydia, and since it's silently carried often in the male, you may not know you're passing it back and forth, the tubes can become damaged. Endometriosis can also affect the fallopian tube, so sometimes patients will have an ectopic pregnancy because of that. As Mike pointed out, sometimes it's totally unexpected. The tubes, as he said, are flexible, they're moving around the pelvis, and maybe it sort of got wrapped in a funny way, and just as that sperm and egg met in the fallopian tube, which is our own incubators, they just got stuck in a little crevice, and it just decided to sit there and grow. And I mean, here Heather had these 2 uneventful pregnancies, celebrating her 3rd pregnancy, felt I'm sure everything was great, and then next thing you know, off in the emergency room. In our practice, we any pregnancy is sort of a suspect for an ectopic until it's proven otherwise. So we monitor our patients very closely, and we check blood tests every 2 days. We do very early ultrasounds. So it's very rare that we're surprised by an ectopic, but even still, occasionally we are. And I think that's, any patient who has missed a period or has a positive pregnancy test and has pain or bleeding, really has to be concerned that this could be an ectopic pregnancy.
Okay, so we have the ovary and we have the brain that controls how those hormones are secreted and then how ovulation occurs. And we see that sometimes that communication doesn't exist, or for some other reason they're defective eggs because of age. We know the fallopian tube is where that egg will be fertilized by the sperm, so that sperm has to be able to get there, and I want to hear a little bit about that in a minute. And if that fallopian tube can't transmit that egg to the uterus, which seems to be where you carry that baby, is that an area that commonly is involved in fertility?
Well, tubal transport of the embryo into the uterus, that's hard to diagnose because we really don't have any tests for that. So it's an area of uncertainty in medicine. We look at the eggs, we look at the sperm, we look at the ovulatory factors and so forth, but to actually figure out is fertilization occurring in the fallopian tube, but the embryo is just not moving down into the uterus, we really are limited there.
Are there anatomic issues with the uterus that would make it difficult to get implanted anyway?
Yeah, like fibroids, polyps, things like that in particular, scar tissue, inflammation, just idiopathic inflammation, that can cause problems, and those are the things we look for when we do infertility evaluations. Yeah.
So if someone was thinking that might be the area where there's a problem, does it affect their periods, or I know you had no period, so it wouldn't have affected yours much, but are there signs that people might have when fibroids or some other issue might be causing their infertility?
Yes, not uncommonly they'll complain of heavy periods or bleeding between their periods, and these are signs and symptoms that these other issues such as fibroids or polyps exist, or inflammation.
Okay, so there are a number of different places where this can occur, and then of course there's the whole issue, as I have to see it as a pediatrician, when babies are delivered prematurely because the uterus can't sustain a full-term pregnancy. We'll talk about that a little bit later. I just wonder, in the process, did you end up having to be examined?
No, I'm going to call it when needed. That's what I said.
So you were just there to service the situation.
I guess the whole question wasn't with our first child. I mean, I had no clue about anything. This whole process is completely foreign to me, just because, like you said in the beginning, you want to have a baby, you have a baby, and so I didn't really even think about it. So, of course, Carrie's always taken the lead on these things, and I go with her to these appointments, and Dr. DiMattina tells me when I'm needed, and I have to say, well, when you need me, and then I'm there for it. But I guess, did I have to be examined as far as infertility goes? Right. I guess with, in our situation, no. I guess basically early on, because of the fact that we knew that, like you said, Carrie was very easy to figure out, right, I guess, what our issue was, and so that kind of eliminated any other thing. Yeah, that caused, but,
Okay. Well then, I'm sorry, it's up to you to tell us, did they have to evaluate you in any way, shape, or form?
Not really, actually.
No? Okay.
I had older children, so the biology was already shown there, and as Dr. DiMattina mentioned, the males can go pretty old, so even though I'm a few more years, I'm still going strong, so I was okay with it.
That's good. Well, you know what I'm trying to get at.
Well, you want to hear about
semen
analysis,
yeah,
andrology work,
right,
and yes, I'm sure both of these gentlemen did do their part.
They did.
And you can see
so you
that
were trying to hide it. That's it. So they did your analysis, and well, I could make some terrible jokes about it, but it was a very important part of the workup.
Oh, it certainly was,
yeah,
and
you
I
complied.
don't know whether I'm going to say
right.
but,
okay.
I passed.
Okay.
Yes.
Well, that's good. What percentage of pregnancies are inhibited by a male factor?
Well, yeah, I mean, in general, we say 40% of infertility is on the female side, 40% is on the male side, and 20% is basically a combination. So it's a lot. I mean, it's really, you're talking about more than half of our patients also have a male factor. And, it's when the guys are sort of reluctant to do their part and give a semen analysis specimen, I'm like, well, is this painful? If it's painful, maybe you better go see a urologist right away, But they're afraid of being reduced down to that number. It sort of goes back to like keeping baseball statistics, like, oh my gosh, I'm only 42%, I wanted to be 51%, and it's that type of thing. But it is a huge part, and I think that if you don't look at this as a disease of couples, you will be, really, sadly mistaken in terms of how you work through the patients. And it's upsetting to us. We'll sometimes see patients coming in from the outside, and woman was placed on Clomid, which is a drug that you give to patients who don't have normal ovulations, and they were just given it like it's candy and said, okay, come back in 6 months, and no assessment was made of the fallopian tubes, and no semen analysis was done, and then you find out that the sperm test is really not normal, and only one tube is open, and here this person has wasted 6 months, and she's been on medication. It really wasn't that helpful. So I think it's important to really look at this as a disease of couples and make sure that you really have the information at your hands and not just make assumptions. We've both had patients who are surprisingly enough where they've had a child together, and a couple years later they come in and the guy's saying, I'm sure I'm just fine, and then you're just shocked and you see this semen analysis which is markedly abnormal, and you're wondering, well, was it the one lucky one that made it up 5 years ago, or has something changed in his health, or is this just a bad sample because, as Mike pointed out, 2.5 months ago he had the flu. So I think that it's really an important part because you just can't tell. You simply cannot tell by looking at somebody, is there an issue here?
So there seem to be, relatively speaking, some issues that men can at least be aware of that helps their fertility. I mean, obviously you said one, if you had a bad viral illness, sometimes that will knock out your ability to produce the numbers or the types of sperm that are going to be active and able to fertilize an egg. And then you also before had mentioned cancer and cancer chemotherapies. Obviously that might do something to those cells that are going to be producing sperm. It might get the numbers. But are there ordinary things that guys do that may affect their sperm counts?
Yeah, they, a lot of men take medications for, say, their cholesterol, and they seem innocuous, they're very healthy and so forth. But a lot of the cholesterol medications affect the sperm quality, particularly with the shapes of the sperm. That's called sperm morphology. And so we'll see people that come in and we evaluate the male, and sure enough, he's got a sperm problem and he's on medications. Other things, too much alcohol.
Right.
Or, smoking's not good. Then sitting in hot tubs for a prolonged period of time, this is not good. Exercise is very healthy. It's been better quantitated for the female as to the limit that she can have. But also in men, if you're running marathons, there's been some studies that have suggested that may affect sperm quality in an adverse way in terms of one's fertility. So there's a lot. The good news about guys we have a lot of things we can do to help them. It does not take very much sperm to make a baby. I'll never forget this guy I saw. He came from Africa. He's from Congo, and he had a young wife. I think he was around 40 and she was 29, and he was azoospermic, meaning he had no sperm. So we put a needle into his testicles to get sperm, and there was none. So we made an incision, cut out part of the tissue, and we found 6 total sperm. Now, put that in perspective, the normal sperm count would be 20 million to 200 million, and he had 6 sperm. And we actually made a baby for that couple because we picked up the sperm and we injected it directly into her eggs through IVF,
wow.
Transferred 2 embryos into her, and she had a baby. It's remarkable. So with some of the technologies we have today, I always tell the guys, hey, we're just like the Marines. We're looking for a few good sperm, and we can make a baby.
That's great. Well, and I guess that also brings up another thing. You had a prior family. Many men would consider a vasectomy. That wasn't something you considered.
No, I never did.
That's
and
good. I'm
part
sure.
of that was because of my wife and our situation. And as she said, we're both professionals, and we had our careers and things. And I know vasectomy really never came up. But I imagine you could probably talk about the reversal of that.
And that is another thing. I mean, some men don't realize that they can have them reversed if they choose at a later time to.
But with the technology that we have today, vasectomy reversals are not necessary.
Right.
That's a surgical procedure. And as I was mentioning before, we can take a needle, just an ordinary needle you would put in your arm to draw blood, place it into the testicle, aspirate out sperm, and produce a baby with no surgery whatsoever. We do it all the time.
And just to sort of harp on that one point that you made about temperature and the fact that men sitting in hot tubs, but really testicular temperature will affect their fertility, and people who are looking to get pregnant actually, I mean, they should at least let themselves hang more naturally for the coolness of the air that actually will improve their fertility. And the wintertime, men are more fertile than in the summertime. Is that something
Thanks, Mike.
How many kids do you have?
Yeah,
Is that?
sure, yeah.
I got
right. Well, there actually have been a couple of studies looking at this whole question of, boxers versus briefs.
Right.
And, the problem is this, is that when you look at semen analysis, it's going to fluctuate all the time. If you look at a couple who's come in and they've done a couple procedures, there's a lot of fluctuations. So if he stopped wearing briefs and switched to boxers and his count went from 23 million to 56 million, you say, wow, what a great improvement, But is that really true? Because there's always going to be this background fluctuation. So the problem is it's very hard to prove that. Now, one of the reasons that urologists will do varicocele repairs and remove varicocelectomy surgery is because they believe that. But the data on that, of actually doing that surgical procedure as a way to enhance male fertility is really not very good. And, we deal with this a lot. And we say, listen, as Mike pointed out, let's just get a baby out of this. Why do you want to go through the surgery? Unless you're having symptoms from your varicocele, let's go forward. The other thing in the vasectomy situation is you'll get anti-sperm antibodies being formed over time. So that if you're 10 years out and you are successful at putting the vas deferens back together, even though the sperm look normal, they may be coated with antibodies. And now they can't fertilize the egg even though they look normal. So you end up wasting precious time. And, as we've talked tonight, time is an issue. Really that biological clock or gong, as we said, is going off.
Depends on your age,
we're really
sure.
trying to move forward.
Yep.
We should tell the college students, don't use hot tubs as a form of contraception.
Right.
They might be
Okay.
disappointed.
Yeah, you can't rely on that. Well, essentially, though, you're bringing out a pretty important point because a lot of men would naturally go to urologists first, and they might be really subjected to some unnecessary procedures when, in fact, it's a little bit easier from the point of view of artificial insemination and in vitro fertilization to get a sample. That's really a very important point. In the process of your workup, did you go to your obstetrician, your plain old OBGYN, before you went to a fertility specialist?
No, because I think I was pretty aware that if nothing was happening within 6 months, to seek fertility help. So I went fairly quickly to see Dr. DiMattina, and I'm really glad I did because we were, already behind the 8 ball with my age because I started at the age of 36. So I was happy that I went to see a fertility specialist quickly.
You had to go through a pretty significant evolution, deciding at some point when you really had thought you never wanted to have babies, and then when that gong was vibrating and you realized, yeah, I might really feel that this is the right situation and I'm happy and ready to do it. What kind of treatments did you undergo?
Well, the thing with me was my tube was blocked, so the only thing we did was to tie one of my tubes. And then we just proceeded to go through the in vitro fertilization, and we did have some successful goes at it, but unfortunately I wasn't able to at the end of the day to conceive. But we gave it a college try. So. Yeah.
And I want to hear a little bit more. You work with Dr. DiMattina and Dr. Gordon.
I do. I'm one of the nurses in the office.
And you probably have to go through a lot of people going through lots of emotional ups and downs. The process for you, of course, is to help them feel comfortable and confident in the process of their fertility treatments. And then if they do become pregnant, do you continue to follow them thereafter as well?
No, generally after a couple of ultrasounds, the doctors will release them to their obstetrician for just routine prenatal care. Generally after they see a heartbeat upon ultrasound with a positive pregnancy.
Boy, that must be hard to do.
It is.
All that work?
It really is.
It's hard to let go.
Yeah.
We're like a reproductive emergency room.
Right.
They come in and see us and get pregnant, and they leave us and go to their OB/GYN, or they come in and see us and they don't get pregnant, and then they move on. And that's the downside of what we do, to be very honest with you. I mean, I'd love to be, in one sense, delivering their babies, but in another sense, I like my sleep at night.
Sure. Well, that was obviously a choice you made when you decided to do this. And you guys end up doing any of the surgeries that we were talking about? Tubals and things of that nature, so you do some of the laparoscopic surgeries as well? So that's another part of the training and part of what you do to try to spruce up the reproductive tract, get it ready and able.
But I should point out that, I've been doing this for a long, long time and started in the early 80s, and infertility treatments were primarily surgical in those days. And I used to operate 3-4 days a week, sometimes every day of the week. Now, I do 4, maybe 6 surgeries a year. So the good news is that we've gotten better at this. We have more knowledge, more technology that's available. We've refined it. So that now infertility can be treated in an office setting, I would say well over 95% of the time with no surgery necessary whatsoever.
So you had implantations, so you had fertilized eggs.
Yeah.
And what technique did they use for you? Was it just a Petri dish in vitro?
Yeah.
And you had some viable implantations. How many times?
I think all told we tried 8 times, and out of those I had 3 pregnancies. I think the first one was ectopic, which was a shame, and then the second one didn't. The second one, actually, I did become pregnant, and but the baby was diagnosed with Down syndrome, so we decided to terminate the pregnancy. And the third time I got pregnant, but it only lasted for a couple of weeks, and then unfortunately, we think that the eggs were probably a little bit too old at that point in time. So,
well, you are an incredible model for understanding what it takes for a couple to make a decision. I mean, this is a pretty significant decision, first to go forward with fertility treatments, and then to work through some of the emotional issues of losing a pregnancy. That's a lot of roller coaster.
yeah, I think it was. I think it really helped actually going to this particular practice because they were so small and intimate that they made the process much easier, I believe, than perhaps, really big impersonal practices. So that really helped. There were some ups and downs for sure, but you can't let it beat you, so you have to move on.
Did you originally decide how long you would try before you would stop, or was it just getting beat up through the process that you really decided you'd had enough?
Yeah, I think after, because we'd been trying all told 2.5 years, and after 8 times, I think we decided to kind of, we weren't really willing to invest, all the time and effort that it took and the heartache. So I think it was time to kind of let go and move on, and perhaps, look at adoption and other things like that. So. But I'm not sad I did it, because I think that we can look back at our lives and say that we really tried. We really, really tried.
That's a beautiful thing, and I give you a lot of credit for going through it the way you did, and actually wanting to just share your story with our audience. Did you have any preconception for this kind of conception?
Well, like Heather mentioned, we were really spoiled by our first 2. It came very easy. We had no idea what a blessing that was, and it wasn't until the ectopic and then a couple subsequent rounds of in vitro that didn't work that was really, an eye-opener for us, and we realized, it's not just a slam dunk, and it really does take a lot of work at times.
Did you set yourself up with any expectations that, well, we'll give it this much time, if it doesn't work, then?
That's a good question. I'm not sure if we ever had that specific conversation. I think when you're going through it, you really try to be positive and think, okay, this time it's going to work, and you almost don't let that negative thought, well, it obviously creeps in, but you kind of try to block it out as much as possible. But after a failed round, comes, it really hits you, and it is devastating for a while. And
it can be pretty sad.
Yeah.
Some people don't understand that going through, I guess, the expectation, or as we just heard, you actually get implantation, you lose a fetus early in the process. It's like losing a live child. Your expectations are built up.
Oh, certainly. I mean, Yeah, I think, some people think it's not real until the baby is born or gets further along, but that's really not true. I think it's it's real, and you have hopes and expectations, and from the moment you start. So it can be just as devastating.
Very emotional, and you have to be close. You have to rely on each other. You have to trust each other.
Definitely.
You have to talk to each other.
Definitely.
Can't get angry at each other.
Well,
you may once in a while yell at each other, but you can't stay that way, right?
No, I do think it can really build your relationship. I mean, I think we were fortunate that it brought us closer. It was one of the first really difficult things we dealt with together as a family, and I relied on him so much because I tended to get worked up in the emotions and the disappointment, and he balanced and said, okay, let's plot this out, let's figure out our game plan, and he directed us towards Dominion Fertility, thankfully, and it all worked out. But
Dr. Gordon, tell me, you must see incredible stress on marriages going through this process. People feel guilty. It's my fault. It's your fault. We spent this much money, this much time. We've invested all this. Parents, I guess, their grandparents, I guess, they can put a lot of pressure on families. What kinds of emotional and other sorts of stresses do you see come out in the situation?
It's just, as we pointed out, it's huge stress. I mean, I think the isolation that people feel. I mean, they don't want to go to the mall because everyone seems to have a child. They're going to their high school reunion or their college reunions, and everybody's got a baby, and then they're laughing, saying, "Yeah, we were using 5 forms of birth control when we got pregnant," and you just want to strangle them. And so all these things, it's very hard. And I think with the internet, with shows like you have here, I think that, as Mike pointed out, things have really changed a lot. So I think that sort of the stigma attached to infertility has really sort of dissipated. And I think that now, we've got over almost 5 million IVF babies worldwide. In several countries in Europe, you're up to 2 to 4% of the newborns are conceived through assisted reproductive technologies. So I think that everyone sort of knows somebody who had an IVF baby, and I think that helps. But still, I think the pressures you say from family and expectations are really are very hard, and especially when couples have been to another center and then they come to our center, and it's almost you're trying to help them undo some bad habits and try to fill their needs, and they're burning out. And as Sam can attest, patients will vent at the nursing staff because they're so stressed out, but they won't really vent to the doctor because they're somehow afraid of you or a nice doctor. And so we see that, and it's really sad though. Some marriages don't make it. And I've had over the years, several couples that ultimately did get divorced, and that's very sad. But the stresses on a relationship are extreme in this case, especially if there's a feeling of guilt. It's my fault, or it's my fault, or they have different expectations about what it is to be a family. And the question is being a family carrying a pregnancy? Is being a family contributing the eggs of the sperm? Is being a family none of those things? If it's none of those things, then adoption is a viable way to have a family. And I was always impressed when I came down to visit over 10 years ago to visit Mike and decide if I wanted to come join the practice, that he talked about adoption right off the bat with couples, as a way to have a family. And I thought that was to me very impressive. And so again, I think there are all different paths in life that you can take, and to understand that there sometimes if one path doesn't work out, then other paths may be the way to go.
Well, it's funny you talk about how it can strengthen a marriage. It looks like, well, you two sort of have that strange sort of relationship, yeah, yes. But it's a very important thing to be able to work together that way and in concert with your patients, and that's a very, very strong suit that we can see coming out from your patients here. But I'd say that really adoption gives people hope. It gives you that expectation there is an alternative if it doesn't work. But they're talking about how easy it is now. They don't do surgery, and they just sort of wave that magic fertility wand over you. Was it quite so easy?
No, not so easy. 2 IUIs.
Which you'll have to describe what those are.
Well, let Dr. Gordon.
Okay.
Intrauterine
Insemination, right.
Okay,
Right. So
very good.
fertility drugs with artificial.
So you had to do
Right.
some timing. You had to test things to know at what point in your cycle you were, or
Shots every day
Yeah.
to stimulate the ovaries. Going in almost every day for monitoring so that they could make sure that my ovaries were producing nice sized follicles, that we were hoping that there were eggs in. And then compliance, doing exactly what they told me to do, getting a phone call every day from the nurses, making sure I took the shots at the same time every day, making sure I triggered exactly when they told me. Triggering matures the follicles and matures the eggs so that they can retrieve them in a certain number of hours. And then you have mild surgery. I mean, I don't know what happened during the surgery since I was asleep, but
that's a fortunate thing.
they retrieve the eggs and then they do their magic in the lab. And 5 days later, in our case, transferred a number of embryos, and hopefully you get pregnant. But we went through 3 IVFs before we were sort of lucky on the first one and got pregnant, but that ended in a miscarriage because of a genetic anomaly, and then didn't get pregnant on our second one, and then we're very lucky on our third one, and we're pregnant.
And you have
with
twins.
Yeah, one's back in the.
One had to take a little nap.
Yeah.
That's okay.
But this is Rind, yeah.
We know he's going to be hard to keep in at night when he's a teenager. He's having a good time right now. So it wasn't so easy for you. In fact, I know that you sort of kept a record in a much more tangible fashion of the whole process. And we did take some pictures of your box. Where's your box been?
On the very top of the closet.
On the very top of the closet. So it was at your bedside for a while.
Well, it was always kind of stashed away because we have 2 girls who are curious. So our
Right.
biggest thing when we started IVF was them not seeing any of the shots or any of the gear. So it started up on the closet and on the top shelf, and he would bring it down morning and night when he gave me my shots. And then it just became kind of a superstitious thing that everything, once we had our third round of IVF was when we got pregnant, and it just became something that was too good to be true, and we just wanted to freeze everything exactly how it was. And talking before the show, I think there are other folks that share that mindset, that it was just too good to be true, leave it there, don't throw any of the syringes away, and someday someone's going to find that box and think I'm really strange, but I have a great son to show for it.
So it's sort of like the baseball player who has the same ritual every time he gets up to the plate. He's just not going to deter it, because the last time he hit a home run, you just don't want to mess with that
Absolutely.
routine. So in your box, you have all the syringes, all of the containers that you put your used syringes into. You even have old alcohol swabs.
I guess you can look at him. This was more, he was very hands-on. I'm not terribly good with shots, so he was very hands-on with doing the injections. But we joked beforehand, when you order your meds, you get as many free alcohol swabs and needles as you want. So
That's great.
why not just start a supply of alcohol swabs and needles?
You never know.
Exactly.
And so you've got a beautiful family, and I know that we have a picture of you with your children, which hopefully we'll be able to show, and just to see how beautiful that really is. And of course, the youngest one is the most recent one.
That's right.
Are you thinking about any more?
The youngest one was also the toughest one. He's given us a run for our money. So
Well, wait, we joke.
so,
When he was
yeah.
a baby, he was so good
Yeah, he was
that
perfect,
he
yeah.
would tell people that you get what you pay for.
Yeah.
Right. I see.
The most expensive
It's
one.
expensive.
Yeah.
However, we
returns.
had 2 girls and he's a boy, and he's a boy.
Yeah.
And so we're working really hard right now. So
Yeah. I keep wondering if I'm going to wake up one morning and say, okay, you know what, things are under enough control that maybe we can go for another, but I don't know. That day hasn't come yet. So.
Well, it doesn't sound like you're going to be the one who makes the decision.
Yeah. Well,
What makes you
Sounds
say
like you have your own gong.
You know, we jumped IVF earlier than some people might have said we had to, but we really did want a big family. And for me, as soon as someone told me I couldn't have babies the old-fashioned way, I wanted to prove them wrong. I was not going to be told. I went into that ectopic with no pre-existing condition. I mean, there was nothing wrong with me. So the fact that I had this ectopic, I said, oh, that was just a one-off. This is fine. And so it was really hard for me. I think the hardest part in the process really for me was making the decision that we're going to do IVF. We have to, and then we did it. So now it's the whole doing it again. I don't know, you know? We have a great family, and there's a whole element for me, tempting fate. So I was,
Yeah,
we're
I think
good.
that's it. I think you've thought it through. Now you know what she's thinking. It's important. It's good. But you have multiples. Now, was there any chance that you would have had more than 2?
Like after them?
No, when they were implanted.
We actually were pregnant initially with 3.
With 3.
And we lost 1 along the way, probably a genetic issue.
Okay.
That's the most difficult thing with being advanced maternal age is that the genetic issues that come along with the eggs, and there's really nothing you can do. The doctors work really hard at culturing out the eggs and the embryos as long as they can, and you think that once they get to blast stage, which is 5 days, you've got a pretty good shot that those will be healthy. But 50%, probably in women my age.
Okay. So you were talking about how you make it happen. Now, one thing you talked about was using drugs, chemicals that stimulate ovulation, and having that as a source. Do you use those, Clomid, you had mentioned before?
Sure, all the time. But, you know, we talked about how things have progressed, and John and I, in January of 2007, brought into the Washington area IVF with no drugs, called natural cycle IVF. And we still are the only practice in Washington doing it. There's only probably about 4 or 5 centers in the entire country that do it. So things have progressed even in the last 2 years. It's done extensively in the Europe and in other countries, but in the United States, for some reason, it hasn't caught on. But there's no question in our minds it's got a place for patients who, not for everybody, but for those who really don't need all those drugs. And we've produced many babies just going in, snatching the 1 egg that they produce every month. No stimulation drugs whatsoever. How nice is that? Collecting the egg, fertilizing it, transferring 1 embryo, and producing 1 baby. And actually, the very first baby in the entire world in 1978, Louise Brown out of England, was conceived through natural cycle IVF. They didn't use any fertility drugs. They did do surgery to get the egg. They had to do laparoscopic surgery, which nobody does anymore. And what happened was they had to treat over 100 women before they could produce that baby. Well, that's no good. Nobody wants to be 1 out of 100. So that's why fertility drugs got started in the IVF process. And now John and I, we probably do as much natural cycle IVF in our practice every day as we do stimulated IVF. And so, you know, things have gotten better in terms of the field of fertility again.
Multiples, that can be a risk then.
Yeah.
You know, you have a special situation. They had to want to get the eggs. You can use donor eggs. You can have other people contribute sperm. You can do all kinds of things to customize if you don't have the anatomy or the opportunity. But we won't go through that. But in fact, you've done pretty well with the way your eggs implanted, and you were able to get 3 separate pregnancies with singletons. Or do you have a set of twins? Do you have a set of twins? The first ones are twins?
No, we've done IVF. I consider it 3.5 times because
Okay.
we had 1 cycle that was canceled before implantation. I guess that's we did a fresh embryo transfer, and that gave us our first child,
Right.
who's now 3. And then we used some of our frozen embryos, and we I guess about a year later did a frozen embryo transfer, and that gave us our second child. And then we had planned to do another frozen embryo, but those eggs that we had left didn't develop the way they wanted them to, so we canceled that cycle. And just recently we did another fresh embryo transfer, and I'm now pregnant with twins.
You're now pregnant with twins.
Mm-hmm.
Ah, so you're saying that in a way that's a little bit curious. Is this something that, how far along are you?
About 8 weeks.
8 weeks. So this is about the time when you'd say, you know what, I am pregnant.
Yes, I definitely feel pregnant.
Yeah. Well, you look wonderful.
Thank you.
You look very, very healthy, and I'm sure that this will be a great pregnancy. Twins. I bet you're really excited.
Yes, a little excited and a little wondering what we've done. We'll have 4 kids under 4.
Well, you can send out the, I guess, the SOS, any help
Yeah.
from anybody who wants to contribute?
Yeah.
Yeah, your teachers. It's 4 kids, it's a lot of work.
Yeah, I mean, with our situation, Carrie was always, like you said, there's a certain, I guess, I won't say it gets scary when the first time you realize it's not naturally going to happen, just all of a sudden, you know, you're pregnant. But we've always said that these are the children we're supposed to have, and our 2 boys we have at home, they're supposed to be who we have, so we're there for a reason. And yeah, when we found out, we always said if we're going to do it a 3rd time, which we were going to, we said, what happens if we have twins? And you know, we said it is when we found out we're happy as long as we have healthy babies. And no, I don't know what we're going to wind up doing, but we have family in the area.
I'm sure you're going to need some help.
Yeah, but we're very happy.
And you have set up some things with your practice. Well, first of all, I know you have a book that you put together because you must be asked the questions over and over again. And as you told me earlier, you were worried about people going to the wrong sources because, you know, from looking at nutraceuticals and all other kinds of things you see on the internet, I imagine this is an important part of what you help people get oriented with fertility.
You know, I think we brought up the issue of stress, anxiety, depressions, how it affects everybody. I can't think of another area of medicine that's more stressful. I mean, most of the couples who I see are extraordinarily successful in their professional lives, and pretty much were able to achieve most of the things that they wanted to achieve, but perhaps the one thing that's the most important in their life. And so the way we help these couples with stress, because that's our job, and that is we educate them, we try to empower them, put them in control, because a lot of people feel they're out of control, they're helpless, what am I going to do? And you know, John and I really have the easy work. We just tell them what to do. Yep. And our nurses, God bless them, they're on the front lines, and they're helping the patients more than John and I are just putting the whole process together, telling them what to do, and educating them.
Well, I know you have a website, and I know that you have actually some interesting elements, and I encourage people to check you guys out, especially if they're looking to have a family. I want to thank you all for being here. I want to thank you for giving us this great insight, and I want to thank you for watching. And of course, until the next time, I'm Dr. Russell Libby, looking out for your health.